Welcome to Healthy Living. I'm Lori Johnson. Today we have great news to share with you. We'll tell you about new and improved ways to treat certain issues that affect millions of us, either personally or through someone you love. We're talking about strokes, brain aneurysms, and back problems. These issues are, of course, scary, but a lot less so when you consider a new technique that's less invasive and still effective. Take a look. Neurointerventional surgery takes a giant step toward improved treatment for the head, neck, and spine. Instead of cutting into the skull or exposing the spinal column, neurointervention uses tiny incisions no bigger than the size of a nickel. The doctor threads a small tube like a catheter through the opening and into a blood vessel, then works from there. A machine like an X-ray allows the doctor to see what's going on inside the body. Dr. Richard KLUCZNIK, the president of the Society of Neurointerventional Surgery, says it can be used to treat aneurysms, strokes, spinal compression fractures, and more. Dr. Richard KLUCZNIK is here now to tell us more about this. Thank you so much for being with us.
Thank you for having me.
You are one of the world's experts on stroke, particularly treating strokes with neurointerventional surgery. But we need to back up a little bit because there are a lot of folks watching now who don't really even know what a stroke is. They may have not had one in their family, and they should be grateful for that. But these things can strike at any time. So basically, a stroke is a blood clot in a vein or an artery in your brain. Talk about that a little bit more.
Yeah, there's two types of strokes. We call hemorrhagic stroke, which can come from an aneurysm that burst, but more often it's ischemic stroke where a clot has come from someplace, either your heart or your arteries from having bad arteries. The clot goes upstream and lodges in the artery that leads to the brain, so one major artery that goes to the brain. And we have a kind of a quick mnemonic to remember so patients at home or the families can know what's going on. And it's fast, so you look at if you're talking to someone, their face starts drooping, arm, if their arm is a little bit weak or something, speech. We've had people on the phone with their loved ones, and their speech becomes garbled, and immediately they call 911, and of course time is brain. So those are the things to keep in mind for a stroke. That means a clot has gone up into the brain and lodged there. Now we have a certain window to try to get that clot out. There's a clot busting drug called TPA that is good in the first 4 hours, 4.5 hours, but it doesn't work for all the big major type strokes where a clot actually blocks a major blood vessel. And that's called a large vessel occlusion. And we tried to give it a fancy name, ELVO, emergent large vessel occlusion. We thought about using Elvis, but that'd be Elvis Presley, and we couldn't do that. So
that's a lot easier to remember, though.
It's a lot easier to remember. And in the last few years, we've had devices now that have come up, and we've had great success at getting the clot out. Mm-hmm. So we will go 6 hours, but we're extending the window now out to people even further on out. So what we do is we get the patients in, make sure to diagnose that they do have clot. Mm-hmm. And we go inside the artery. So we go from either we say groin, but it's really the artery right over the hip, or sometimes from the arm. And you go up all the way to the arteries in the brain, and there are devices that are designed to pull the clot out, mm-hmm. and there are some devices designed to suck, actually put suction, and suck the clot out. And we're very successful at this day and age now of getting the clot out, and then reestablish flow to the brain.
Fantastic. It kind of reminds me of a cork in a bottle. You go in there, you get the clot out, and you yank it right out, and then all the blood can start flowing again.
Well, it's funny you say that because one of the first devices looked exactly like a corkscrew, but it didn't work as well. I'm probably not strong enough to do it, but it looked like a corkscrew, but it didn't work. Mm-hmm. So now we have newer devices that actually do work to get the clot out.
So back up a little bit. A lot of you talk about this window of time. You got to get these patients in your care. 3 hours is best case, 4 hours, 6 hours. You're extending it, but the faster the better.
The faster
so
the
we
better.
need to, but a lot of people don't recognize when they're having a stroke because sometimes it's not real obvious. You talked about FAST. When you talk about the face drooping and the arm, what about the arm? What are we supposed to look for with arm movement?
Just simple, just strength, overall strength. If someone's having trouble, pick up a cup of coffee, or they're just having trouble know, in general, their arm or the leg is weak. So just we're trying to get, you know, arm or just something that you notice that they're weak on one side or the other. So just something simple like that.
Yeah, so like if you're with someone and they're acting a little bit strange, you might want to say, Mom, can you pick up this cup of coffee?
Or can you grip my hand? Hold my hand.
Grip my hand. That's a good test for it, because a lot of people aren't aware that they're having a stroke. So we really need to be on top of these symptoms. And then when you realize that someone's having a stroke, you've got to get them to not just any hospital.
Correct.
And that's kind of a tricky situation too, because ambulance drivers are by law required to take you to the nearest hospital, but that might not be where they do neurointerventional surgery.
Correct. We want to go to what's called a comprehensive stroke center that has all the capabilities of people who can go and extract clot and get clot out, as well as having a good intensive care unit. We are trying right now, there's two programs underway right now. One is our society, the Society of Neurointerventional Surgery, has teamed up with Get Ahead of Stroke. It's called Get Ahead of Stroke. And that is a program where we're trying to go state by state by state. They've had great success at Tennessee, Florida, Ohio, working on Massachusetts and New York, where they go to the state legislatures and go and change the EMS paradigm. So the emergency medical services, when they go to pick up a patient, for them to recognize there's a stroke, and a simple test that they can do, any emergency medical person can do an exam, they think that's a stroke, and then get them to a comprehensive stroke center. But we're trying to change that to call level 1 stroke center level 2, because everybody knows what a level 1 trauma center is.
That's the best.
That's the best. So we're trying to change that a little bit, because we say comprehensive, they may not know what that is. So we're working on several fronts to change it, to get patients to go to the right hospital, the proper place where they can be treated, and not to go to some place that may not have the capabilities.
Right, because every second that you delay getting either the neurointerventional surgery or the TPA, like you talked about, if it's a small clot, or both, is seconds. It's valuable time. How many neurons are lost, brain neurons are lost every minute that a person...
They say it's about 1 million neurons lost every minute. And if you can, sign of the way the statistics are, that if you can get to and pull the clot out, you save a week of someone's healthy life for every minute that you've managed to get the clot out. So it's further down the line, because stroke is a major form of death and disability in this country, but it's disability, because once you've had a stroke, then you're weak on one side, forever having trouble speaking, or you may end up in skilled nursing homes. But if you can get to them early, you change that so that the stroke isn't as bad. They may be cured, but you may change it so it's not as bad as it was, and the people can recover.
Your Get Ahead of Stroke program is fantastic. I went on the website, and there's so much great information. So everybody watching now should go to Get Ahead of Stroke, the website, because all the information is on there, and it's really very easy to understand, which is great. But we all need to find out where the nearest comprehensive stroke center is. Right now, you don't want to wait till you're with someone who's having a stroke. And so we all need to find out where it is. And then the second thing we all need to find out is whether an EMT who comes to your home will take you there. In some states they will, but in some states they won't. And then you've got to figure out, how to get that person to the comprehensive stroke center without going in an ambulance, which is really terrible. But I actually know people who have done this, and it made all the difference in the world.
Yes, there's several instances in one major city where they're almost like neighbors. One was taken to the local hospital, and one was taken to a comprehensive stroke center, and one didn't do so well, and the other one did very well, because they didn't go to the proper hospital. So there's accrediting bodies, the Joint Commission on Hospitals, another one called DNV, that accredit hospitals to do comprehensive strokes. So they should be listed: American Stroke Association, the American Heart Association, our website for the SNIS, our society. You can find out, you can go online and check your local hospital to see if it is listed as a comprehensive stroke center.
And do all this stuff right now before you need it, so that you've got it in your back pocket. This is fantastic information, and it's so encouraging to know that you and doctors like you offer so much hope for people who have gone through a stroke. And when we come back, we're going to talk about another very important issue, aneurysms. So stay tuned.
Life. It's meant to be lived fully. Jesus said it. I came to give you life, life to the fullest. Life in your family. Life in your finances. Life in your body, mind, and spirit. Life in your everyday. At CBN.com, we're taking what Jesus said seriously. We're here to help you discover life. Life. Live it fully. CBN.com.
On October 1st, 1961, history was made when a tiny station began transmitting the first signals of the Christian Broadcasting Network.
CBN, the Christian Broadcasting Network.
And now, a new era has begun with the all-new CBN News Channel.
Just moments ago, the Iron Dome intercepted an incoming rocket right on the Gaza border.
Administering in this area, spiritual warfare is definitely involved.
A 24/7 news network, bringing you the news you want from a source you can trust.
In Kenya, 40% of the medical services are actually provided by these Christian hospitals.
Let's talk about the economy.
Believers here are joining together to win people to Jesus Christ.
All your favorite shows now in one place. Go to CBNNewsChannel.com to find out how to get the CBN News Channel on your TV all day, every day. CBN News.
We're back with Dr. Richard KLUCZNIK, president of the Society of Neurointerventional Surgery. That is a mouthful, neurointerventional surgery, but it's so exciting. It's relatively new, and basically you go in through a very small opening. You don't have to cut a person's head open or expose their spine, and do all the work through the arteries and the veins, and you're looking up on a screen. It's sort of like an x-ray thing, and that guides you. It's absolutely fascinating, and you're the president of the society and trying to educate people about it.
Yeah, so another cause of stroke is hemorrhagic stroke, which is aneurysms, and is also vascular malformations of the brain that can bleed too. And so instead of having your head cut open as a way of trying to treat these aneurysms, even once they've ruptured or bled, if we find them beforehand, because people have headaches, so they get scans, and we can find aneurysms ahead of time before they rupture. So we go from the arteries, either the artery down by the hip or the artery from the arm. You can go up inside. And now, in 2019, we have many devices to try to treat aneurysms. One of the first was to put coils, actually make a ball of yarn inside of the aneurysm. So the blood doesn't come in, it heals over and it's cured. And now there are devices that actually look like a mesh that sits in the aneurysm itself. We have stents. Combination of stents with coils, but we have a fancy stent. If you looked at it, kind of looks like a slinky, but it gets the flow away from an aneurysm, diverts the flow, and so the aneurysm heals on its own and clots off. So there's many devices now. So we try not to cut people's head open anymore to treat an aneurysm.
And it's just, it's miraculous when you think about it. And backtracking a little bit, for folks who don't know what an aneurysm is, or what the difference between an aneurysm and a stroke is an actual blood clot in the vessel leading to the brain, and when there's no blood coming through, it cuts off oxygen and your brain starts to die. Now with an aneurysm, it's sort of like a blister on a blood vessel, and and the danger is that if it ruptures, you start bleeding into your head, and how is that deadly?
So I tell people an aneurysm is like a bubble on a tire. It's like a bubble on a blood vessel, and they're actually called berry aneurysms because they look like they're a berry hanging off of a tree. Simple. But when they rupture and they give way, the blood that gets out is very irritating to the brain. It's basically chemical meningitis immediately, and your brain wants to shut down, and it starts to swell, and the blood vessels can start crimping down. Then you start causing strokes that way too. So an aneurysm, when it ruptures, is very bad. The rough statistics are a third of the patients, if they rupture, don't even make it. They may die home or in the emergency room. 2/3 may make it, and a third of those will have long-term disability. So the best thing that we can find them beforehand. But When we're treating aneurysms now in the acute stage like this, again, we save them from having their head cut open so they can survive better. There's no added insult of craniotomy and surgery and touching the brain. So if we can get them and treat them early again, we can help the survival.
So you mentioned it just a moment ago. If you have an aneurysm that hasn't burst yet, that's the best kind of aneurysm.
That's the best kind.
What are the signs? Because you want to, if you're having any of these symptoms, you need to get to the hospital, and preferably a comprehensive, I mean, which hospitals do this type of neurointerventional surgery on aneurysms?
Basically, it's the same type of hospitals, the comprehensive stroke centers or the comprehensive hospitals. But for aneurysms, there are other hospitals that can do it. They don't necessarily have to do the clot busting or clot pulling too. So there's probably more hospitals that can do aneurysm treatment than do the clot treatment. But one of the symptoms for aneurysms is headaches. Headaches that you haven't had before. Even people have migraines. They'll say that their headaches are different. They're different than their usual migraine headaches. If you have a headache that you can say, it's the worst headache I've ever had, worse than anything else, go to the emergency room. That's it. The worst headache of life is the tip-off.
Okay, that's great. Any other symptoms?
Potentially seizures if they're leaking and things like that. Some people just have neck stiffness because the blood maybe leaked out a little bit. Now their neck is sore because the blood's circulating. Those are, principal symptoms.
What are the symptoms of a ruptured aneurysm?
The worst headache you've ever had. Worst headache of life is what it's called. And that's the principal symptom of a ruptured aneurysm. But I mean, people can pass out. People have been at work and they just passed out or just slumped over because it's so devastating when it actually does happen. It's blood that's hitting the brain.
What can people do to prevent from having an aneurysm or a stroke for that matter? I mean, we're talking about all the miraculous things you guys are doing, and thank God for it. But a lot of people are like, I don't want to have one in the first place.
So aneurysms are, I'll go aneurysms first. About 1 to 2% of the population walking the earth will have an aneurysm. It's just as you get older, blood pressure hitting the branch points of vessels, they can get weak and you start bulging out like a bubble on a tire. Smoking. Smokers have a higher chance of aneurysm. Smoking damages blood vessels, not in the heart, not just in the heart, but aneurysms. You know, the aneurysms, I mean, the vessels in the brain are weaker because God gave you a nice big piece of bone to cover them, so they don't have all the muscles. So if you smoke, you damage blood vessels and you can grow aneurysms. And sometimes they can run in families. Now for stroke, of course, diet. Make sure you're eating properly. You don't want to have hardening of the arteries. Again, smoking is another big one. High blood pressure, alcohol, all those simple things that you normally think of, common sense things.
All right, makes a great big difference. All right, well, this is fascinating information, and we're not done yet. When we come back, we'll talk about how neurointerventional surgery is used to treat back pain, so stay with us.
Prophecy thousands of years old.
We were called to be a light to the world.
Being fulfilled today. Discover how. Get to life. Call 1-800-700-7000.
We consider it our duty to reach out and help others around the world.
For a gift of $10 or more, you can own the acclaimed CBN documentary To Life. Just call 1-800-700-7000 or log on to CBN.com.
To treat a human, no matter what he is, which religious he have, which color he is, this is what I'm doing.
See how the people of Israel are fulfilling prophecy.
History is being written, and I want to be a part of it.
By sharing their knowledge.
In Africa, in Asia, in South America, in East Europe.
And their love.
This is how we work. This is us.
Get to life. Call 1-800-700-7000 or log on to CBN.com.
Get Protect Your Sleep and discover how to improve the quality of your life. A free DVD or booklet from the Christian Broadcasting Network.
If you're not a great sleeper, you can do things to make yourself a great sleeper. If you're already a pretty good sleeper, you can enhance your sleep and be even better.
5 leading experts help remove the obstacles between you and restorative sleep.
When you don't get a restful night's sleep, you wake up with an accumulation of stress.
Call 1-800-700-7000 or go to CBN.com to get your free DVD or booklet today.
Everything you do better with a good night's sleep.
You'll discover how food affects your sleep, how to put insomnia to rest, explore effective remedies for sleep apnea, and much more in Protect Your Sleep. Wake up to your best life and get Protect Your Sleep today. Call 1-800-700-7000 or go to CBN.com to get your free DVD or booklet.
Come home to the Southern Gospel Station from CBN Radio. You'll enjoy a rich Southern blend of bluegrass, classic gospel, and Southern Gospel favorites. CBN Southern Gospel. Available now at CBNRadio.com.
We're back with Dr. Richard KLUCZNIK talking about neurointerventional surgery, a minimally invasive procedure. And this is great for people who have back problems, and so many millions of people have back problems, particularly herniated discs and compression fractures. How can neurointerventional surgery help folks like that?
For basically for fractures, we are very helpful. Acute fractures, you know, the aging population, especially women, osteoporotic fractures happen. And what we do is put needles into the vertebral bodies themselves, and we inject cement, methyl methacrylate cement. And what it does, it helps immediately, or pretty much soon after back pain, so your back pain is better, and then it strengthens the vertebral body itself. So injecting cement has proven to be a quite effective method to get rid of back pain from fractures.
Who would have ever thought? And really, what's causing the pain are these two bones rubbing together, right?
Well, the fractures is your vertebral body's collapsing, and then something will give way. And it's just so you can think of any fracture or broken bone anyplace else. That's what it is. It's a broken bone. It's causing pain. It's the nerves are disturbed. So you put cement in to buttress it, make it stronger, and make it better so your pain goes away.
Wow, that's really amazing. And how do people know they have a compression fracture?
Just acute back pain that they've never had before.
And herniated disc?
Herniated disc, they'll still mostly surgery, but there are some things that are coming along that to try to, again, put needles in and go actually and put needle into the disc and try to suck out if it's soft and small. There are things coming down the line, but herniated disc is different. That's the between your vertebral bodies is padding, basically, and that's what the disc is. And if it gives way, the disc may rupture and come back and hit the spinal column, hit the space that surrounds the nerves. And that hits nerves, you got back pain.
And so many people have that.
So many people.
And typically, we've been having neurosurgeons go in there and actually operate, you know, in and around the spinal cord. But what you do, neurointerventional surgery, is you just have a little incision and you go in there through a vein or an artery. It's amazing,
for this,
really.
We're going straight after the disc. We don't even have to go to arteries. But there are vascular malformations of the spine and spinal cord, where those problems are stealing blood away from the cord. Then we go into the arteries or the veins, depending on where we are, and we inject. It was super glue. Same thing. It was basically sterile super glue to block off the arteries. Now we have another substance called onyx. It's a little bit more like lava, it flows like lava, to block off these abnormal blood vessels.
Well, that super glue really does hold.
It holds.
It's used in back surgery. I guess it's a good thing you're not using it anymore, but it worked.
It still works.
As long as it was sterile. So how do folks know if they have a herniated disc?
It's back pain, and usually it's back pain that's hitting a nerve, so it's radiating down your leg. So one leg or the other, depending which nerve it's hitting, when you go to a doctor, you say it's basically down my butt or down the back of my leg or going all the way down to my toes, or weakness, like you can have what's called foot drop. In other words, you've lost the weakness, so you can't raise your foot. You're almost tripping over your foot as you're trying to walk.
And I know for me, if I had that, I would rather have neurointerventional surgery than the traditional kind. What if your doctor says...
The surgery is still, for herniated disc, surgery is still the primary method, so I won't take that. We're a way down the road from being able to treat this kind of stuff by going after it yet, but for herniated disc, surgery is still the answer.
But what if people definitely want to at least see if neurointerventional surgery is a possibility? Are we assured that our doctors will mention that to us, or do we need to mention it to them?
Mention it to them.
Because this is actually a really fairly new field, neurointerventional surgery. It's really been on the forefront for only the last decade.
Yes, it started with neuroradiologists, And then as we started growing and more people got involved, we now, the society itself is basically neuroradiologists, neurosurgeons, and neurologists. So we encompass all three disciplines in our society.
It's fantastic. Well, we're going to take another quick break, and when we come back, we'll talk more with Dr. KLUCZNIK about something that we've been hearing a lot about in the news lately, opioids. So stay with us.
Wouldn't it be great if you could just hop on a plane and fly to a third world country and hand out food and medicine to the needy? And wouldn't it be great if some of those people came to know Jesus as their Savior because of your help? And wouldn't it be great if you could help out people like this all around the world every day? Wouldn't that make you feel great? And what if you could do all of this without having to leave your home or write monthly checks? Well, you can. Partner with CBN and you can help spread the gospel all around the world and make it a better place. And when you sign up for Pledge Express, your contribution will be deducted from your bank account every month automatically. It's a safe and simple way to make a difference. Plus, wouldn't it be great to get life-changing teachings every month from Pat and Gordon? When you sign up for Pledge Express, you'll save time and money, and you won't just sit around and watch the world go by. You'll help change it for the glory of God. Now, wouldn't that be great?
When you care, souls are set free. When you give, lives are made new. When you share, eternal life begins. When we all come together to love, miracles happen.
We're here with Dr. Richard KLUCZNIK, the president of the Society of Neurointerventional Surgery. Thank God for your work and for other doctors like you who are doing this groundbreaking surgery. Where can people find out more information?
Well, there's our website, which is the Society of Neurointerventional Surgery. That site will list all the doctors state by state as to who does these kind of procedures and who the interventionists are in your local area. I work at the Houston Methodist Hospital. There's a website for Houston Methodist Hospital. And we have a website of our own called Houston Neurovascular. So any one of those you can check and see what's going on. The major one, the SNIS, has you can find doctors everywhere and all across the country.
You're in Houston. Lucky folks in Houston can go see you personally as a doctor. You talked about back pain before. A lot of people take opioid painkillers because of their back pain. And you're saying that, and this is, of course, turned into such a crisis, and a lot of people get addicted to these, turn to heroin and fentanyl and the overdoses, and it's awful. But you're saying that you can kind of nip a lot of this back pain in the bud with neurointerventional surgery.
If it is from acute fracture, then when we do and put the cement in, then they may not be on opioids. So you can just take routine non-steroidal anti-inflammatories, Advil, Aleve, Motrin, instead of taking opioids. So for those specific things, we can help so they can not be addicted to opioids.
Fantastic. All right, Dr. Richard KLUCZNIK, thank you so much for being with us today on this edition of Healthy Living, and thanks to you for being with us as well. We'll see you again next time.